Yeah, so
Hi,
the question is, what about fasting and taste? What do we think is going on? Well, actually, we kind of know what's going on now because we've actually done a study. It's not been published yet, but it's being submitted for publication this month. And that was a taste adaptation study, where what we are finding is that the actual neuroreceptors change. You actually get neuroadaptation. And so your ability to detect salt becomes more sensitive. And so, for example, when people come in and they eat Swiss chard, to them it may just be disgusting. After fasting, they find it's so salty they can really taste the natural sodium that's there. And it's because you've overcome their addictions and their perversions. And I think it's really that simple. You just become better at detecting these factors and your desires. Many of you have noticed if you go on a healthy diet, after a while, the super sweet desserts that everybody craves so much become less appealing. They're just too much. If you eat soup in a restaurant, it's like overwhelmingly salty. But the waiter thinks it's great. So I think we're just seeing a change in normalization of the neuroadaptive mechanisms, and taste have to be included in that.
Please wait for the microphone to ask your questions.
Hi, I have a question about the whole food plant-based way of eating. If one is pre-diabetic, is it okay to do whole food plant-based eating because it has a lot of carbohydrates?
Right. It's only okay if your goal is to actually resolve the diabetes. So.
Okay, for pre-diabetes.
Yeah, so the question is, what about if you're first of all, there's no, in my mind, pre-diabetes. It's like pre-pregnancy. It's just a various degree of insulin insensitivity. So if you have early diabetes, what you want to do is actually give the body a chance to heal itself. And the problem in diabetes is not complex carbohydrates. The problem is the things that cause insulin resistance, which is excess calories, which is usually from sugar and oil, and highly processed foods. So when you take a diabetic, immediately, if you put them on a lot of fruit or something, yes, you'll see problems with glucose control. You have to actually have them on the diet long enough to resolve the insulin resistance so that then they can tolerate fruit and vegetables effectively. And so what we do is either put them in a plant-based diet and allow that process to happen, usually rather rapidly, or if it's very resistant, we'll use water-only fasting, which will normalize blood sugar levels, and then after fasting, we introduce fruits, salads, and steamed vegetables. And what I'm telling you is the vast majority of type 2 diabetics are able to do that, maintain normal blood sugar levels without medication. So we're able to eliminate the medications and normalize diabetes. In the most resistant diabetics, the type 1.5 diabetics that are no longer producing optimum levels of insulin, sometimes you do have to further refine the whole plant food diet, perhaps to eliminate certainly all processed. We don't use fruit juices and these kinds of more processed dried fruits, etc. Sometimes we'll even restrict whole fruit in the diet until blood sugar level control is additionally improved. Some carbohydrates like beans have a lower glycemic response than maybe grains, and so you might use a diet that's more dominant in beans so that they get better short-term control. But understand, long-term control is a whole plant food SOS-free diet and, if necessary, fasting. And so, yes, you may need to modify the diet initially as you make the transition into using large amounts of green, raw, and cooked vegetable materials, because those have a much lower carbohydrate count, and as people are losing weight and reducing insulin resistance, that can be helpful for your short-term control. If you want short-term control, just eat meat, right? If you just eat meat, you have no glucose, and so you get a little bit better short-term control. The problem is it makes the diabetes worse until eventually that itself will fail as well.
Yeah, my question is, can you list the what do cancer cells live on? I've heard it's only glucose, and earlier in this conference I've heard that it's not exclusively glucose. Could you please list?
What I can tell you is that cancer cells in general, in terms of their diet, have a higher dependency on sugar than healthy cells. Healthy cells have a better ability to adapt to burning ketone bodies than cancer cells do. So in an environment, a ketotic environment, cancer cells have a selective disadvantage. But if the process you go about creating that ketotic diet happens to be high animal proteins, you also have to outweigh the cancer promoting effect of animal protein. And so now they're starting to modify the diets, trying to eliminate the animal protein that's recognized. It's like gasoline on the fire of inflammation. And so they're trying to come up with more plant-based, higher fat diets. From my viewpoint, you have to look at the bigger picture, not just the one issue, which is one of the metabolic issues involving cancer cells, which might be their glycemic response, but the overall picture of what promotes health. I've already mentioned that I think the real cure for cancer is prevention. And the same things you do to prevent cancer, in my opinion, are the things you're going to be doing to treat people that are already afflicted with this condition.
Yes, I have this quick question. Some people are talking about the difference between being obese, overweight, and the difference between being chronic inflammation, mostly caused by gut leaking or something like that. And what is, if you have any experience or any studies about the implication of utilizing the turmeric to...
Well, yeah, I mean, there's a lot of studies that have been done looking at various exogenous agents, and those are all nice. I'm not the expert in pills and potions and powders. That's not the thing that I address, but I can tell you the effect sizes are quite small. If you want big effects, you have to really get out the big guns, and that means diet, sleep, exercise, fasting. These are the foundations of health. The outside agents, some things turn up or turn off various mechanisms. That's all fine. I don't have any problem with those kinds of interventions as a whole, but they pale in comparison to the really big effects. And I think the real danger to them is they distract people from having to take on the real important work, which is controlling what they put in their mouth, making sure they get to bed on time, engaging appropriate activity, and learning to manage their stress more effectively. If you're doing all those things, in our experience and our results are showing, people are getting so well so rapidly, we don't have a lot of time to sell them all kinds of pills and potions.
Would this fasting be beneficial for people with Parkinson's?
Parkinson's disease is an interesting challenge. We have 2 doctors in our clinic that have been trained by Marty Hines in using his protocol, which involves the use of mucona as a source of L-DOPA and amino acids and supplements as a way of controlling the nausea that's normally controlled by a drug called cardopa. And cardopa has a problem because although it controls nausea, it's the counterpart in Cinemet. It results in some long-term problems that Dr. Hines has documented in dozens of published papers, not the least of which is associated with dementia and other changes that people think is a normal part of Parkinson's, but may really be more about the treatment of Parkinson's. Unfortunately, diet alone is not always sufficient at controlling the symptoms in Parkinson's. So although we combine diet, exercise, balance training, et cetera, we also use this exogenous L-DOPA. And it does work well, and it works well without some of the side effects that come from traditional medication. But it's not a condition that we can treat with diet alone. We do require some outside agents to get the level of control that's desirable.